Hey there, welcome to Concise Anatomy. Today we're tackling a big challenge, learning all the bones in the human body in just 20 minutes. So grab your notes, hit that subscribe button, and let's master the skeleton faster than ever. Ready? Let's dive in. The human body has 206 bones, divided into two groups. The axial skeleton, containing 80 bones, forms the central framework of the body, including the skull, spine, and ribcage. The appendicular skeleton, comprising 126 bones, includes the limbs and girdles, which connect to the central skeletal framework. The axial skeleton, comprising 80 bones, includes the skull, auditory ossicles, and hyoid bone, along with the vertebral column made up of cervical, thoracic, lumbar, sacrum, and coccyx bones. 12 pairs of ribs, and the sternum, all of which provide structural support to the body and protect vital organs. The appendicular skeleton consists of 126 bones, including the pectoral girdle, pelvic girdle, upper limb, and lower limb bones. The pectoral girdle is made up of 2 scapulae and 2 clavicles. The upper limb contains the humerus, radius, ulna, 16 carpals, 10 metacarpals, and 28 phalanges, while the pelvic girdle includes 2 hip bones, and the lower limb features the femur, tibia, fibula, 14 tarsals, 10 metatarsals, and 28 phalanges. The skull consists of 22 bones, 8 cranial bones, which form the cranial cavity, and 14 facial bones, which form the facial skeleton. Here are the bones forming the cranial cavity, which protect the brain. It includes 8 bones, some of which are deeply located and less visible. Here are the disarticulated cranial bones, revealing some of the hidden bones, such as the sphenoid and ethmoid. Let's take a closer look at each of the 8 cranial bones separately. The frontal bone forms the forehead and the upper part of the eye sockets. The 2 parietal bones form the sides and roof of the cranial cavity. The 2 temporal bones are located on the sides of the skull and contain the ear canals, along with the middle and inner ear structures. The occipital bone forms the back and base of the skull, housing the foramen magnum through which the spinal cord passes. The sphenoid bone is a complex butterfly-shaped bone that forms part of the floor of the cranial cavity and connects with multiple other bones. The ethmoid bone is located between the eyes, forms part of the nasal cavity and orbit, and contains the ethmoidal air cells. The sphenoid and ethmoid bones are mostly hidden deep within the skull. But this view reveals the true structure of the sphenoid, a butterfly-shaped bone with 2 wings, and the ethmoid, which contributes to the nasal cavity and orbit. Let's now move on to the facial bones, also known as the viscerocranium. The facial bones, or viscerocranium, consist of 14 bones, namely the nasal bones, maxillae, zygomatic bones, palatine bones, lacrimal bones, inferior nasal conchae, vomer, and mandible. Some facial bones, like the vomer and palatine bones, are deeply hidden, and this disarticulated diagram will help you understand their true location. The zygomatic bones form the prominence of the cheeks and contribute to the lateral walls and floor of the orbits. The lacrimal bones are the smallest bones of the face, located in the medial wall of each orbit, and contain the lacrimal fossa, which houses the lacrimal sac. The nasal bones form the bridge of the nose and articulate with the frontal and maxillary bones. The inferior nasal conchae are curved bones in the nasal cavity that help filter and humidify the air we breathe. The palatine bones form the posterior part of the hard palate and contribute to the floor of the nasal cavity. The maxillae are paired bones that form the upper jaw, support the upper teeth, and contribute to the orbits, nasal cavity, and hard palate, articulating with all facial bones except the mandible. The vomer is a single bone that forms the lower part of the nasal septum, dividing the left and right nasal cavities. The mandible, the largest and strongest facial bone, forms the lower jaw, supports the lower teeth, and provides attachment for muscles of mastication. Now, let's open the cranial cavity to explore its interior, including the skull cap, also known as the calvaria, and the cranial fossae. The calvaria, or the skull cap, forms the roof of the cranial cavity, while the cranial fossae, the anterior, middle, and posterior, create distinct depressions at the base of the skull. These fossae house and support different regions of the brain. Now, let's move on to the ear ossicles, the tiny bones located in the middle ear that play a crucial role in hearing. There are 3 ossicles in each ear: the malleus, which connects to the tympanic membrane, the incus, which serves as the intermediary bone, and the stapes, the smallest bone in the body, which transmits sound vibrations to the inner ear. The hyoid bone is a U-shaped bone located in the neck, just above the larynx. The hyoid bone, located in the anterior neck at the C3 level, is a unique bone with no bony attachments. It is suspended by muscles and ligaments, serving as a vital anchor for the tongue and a support structure for swallowing and speech. The hyoid bone comprises a central body, greater horns extending laterally, and smaller, lesser horns, all serving as attachment points for muscles and ligaments. Here is a front view of the hyoid bone, showing its body, greater and lesser horns. The vertebral column consists of 33 vertebrae, separated by intervertebral discs, providing support and flexibility while protecting the spinal cord. The vertebral column is organized into 5 regions: 7 cervical, 12 thoracic, 5 lumbar, and the sacral and coccygeal regions, which consist of fused vertebrae. Here is the vertebral column displayed in anterior, posterior, and lateral views, showcasing its natural curvatures. The lateral view particularly highlights the lordotic curves in the cervical and lumbar regions, which curve inward toward the body, and the kyphotic curves in the thoracic and sacral regions, which curve outward. Intervertebral discs are fibrocartilaginous structures located between adjacent vertebrae, acting as cushions to absorb shock and allow flexibility in the spine. Cervical vertebrae are the 7 vertebrae in the neck region, C1 to C7, supporting the head's movement. Typical cervical vertebrae, C3 to C6, have a small body, a triangular vertebral foramen, a bifid spinous process, and transverse foramen in the transverse processes, which allow passage of the vertebral arteries. The atlas, or C1, is the first cervical vertebra, specialized to support the skull, with no body and a ring-like structure that allows the nodding motion of the head, articulating with the axis to enable head rotation. The axis, or C2, is the second cervical vertebra, characterized by the odontoid process, which projects upward and fits into the atlas, allowing for rotational movement of the head. The 7th cervical vertebra, C7, is an atypical vertebra known as the vertebra prominens due to its long, non-bifid spinous process, which is easily palpable at the base of the neck. The thoracic vertebrae consist of 12 vertebrae, T1 to T12, located in the mid-back region, which articulate with the ribs to form the ribcage. Typical thoracic vertebrae, T2 to T8, have a heart-shaped body, circular vertebral foramen, long spinous processes that point downward, and costal facets on the sides of the body, and transverse processes for articulation with the ribs. Here is a side view of a typical thoracic vertebra, showing its characteristic long spinous process which is directed downwards. The 11th and 12th thoracic vertebrae have a single costal facet on their bodies. Short spinous process and their transverse processes do not have rib facets. Lumbar vertebrae, L1 to L5, are located in the lower back and are characterized by large, kidney-shaped bodies to support the weight of the upper body. Typical lumbar vertebrae have large, kidney-shaped bodies to support weight, short and horizontal spinous processes, and long, broad transverse processes that serve as attachment points for muscles. Here is a side view of a lumbar vertebra, highlighting its axe-shaped spinous process, which is short, thick, and projects horizontally. The sacrum is a triangular-shaped bone at the base of the spine, formed by the fusion of 5 sacral vertebrae. It articulates with the 5th lumbar vertebra superiorly and the coccyx inferiorly, forming the posterior part of the pelvic ring. The sacrum provides structural support for the pelvis and serves as a conduit for sacral nerves through the sacral foramina. The coccyx, commonly known as the tailbone, is the small triangular bone at the end of the vertebral column, formed by the fusion of 3 to 5 coccygeal vertebrae. It has a base that articulates with the sacrum, an apex at the inferior end, and lateral corn UA that connect to the sacrum. The thoracic cage, also known as the ribcage, consists of the thoracic vertebrae, ribs, and sternum, forming a protective enclosure for the heart and lungs. The ribcage consists of 12 pairs of ribs, classified into true ribs, false ribs, and floating ribs. The first 7 ribs, known as true ribs, directly attach to the sternum via their own costal cartilage. Ribs 8 to 10, known as false ribs, connect to the sternum indirectly through shared cartilage. Ribs 11 and 12, known as floating ribs, do not have any anterior attachment to the sternum. Ribs are also classified as typical and atypical ribs, depending on their anatomical landmarks. Typical ribs, 3 to 9, have a rounded head, a neck, a tubercle, and a costal angle, while atypical ribs have their own unique features. Typical ribs articulate posteriorly at the head with the bodies of the corresponding vertebra and the one above it, and at the tubercle with the transverse process of the corresponding vertebra. Anteriorly, they connect to the sternum through their costal cartilage. Let's now briefly look at the features of atypical ribs. Rib 1, 2, 10, 11, and 12. The first rib is short, flat, and broad, with a single facet on its head for articulation with the T1 vertebra. It has a prominent tubercle for the attachment of the scalene muscles and is oriented horizontally, making it unique compared to other ribs. The second rib is thinner and longer than the first, with a tuberosity for the attachment of the serratus anterior muscle. The 10th rib has a single facet on its head for articulation with the T10 vertebra. Unlike typical ribs, it does not have a tubercle for costotransverse articulation. The 11th and 12th ribs are floating ribs, with a single facet on their heads for articulation with the T11 and T12 vertebrae. They are shorter, lack a tubercle, and do not attach to the sternum. The sternum is a flat vertical bone located in the anterior part of the thoracic cage. It consists of 3 parts: the manubrium, body, and xiphoid process. The sternum has costal notches along its lateral borders, where the costal cartilage of the ribs attaches. These notches allow for the articulation of the first 7 pairs of ribs. The pelvis is a bony structure located at the base of the spine, forming the lower part of the trunk. It is made up of the sacrum, coccyx, and the hip bones, which are formed by the fusion of the ilium, ischium, and pubis. Each upper limb contains 32 bones, including the clavicle, scapula, humerus, radius, ulna, carpals, metacarpals, and phalanges. The shoulder girdle consists of the clavicle and scapula, which connect the upper limb to the torso, allowing for a wide range of motion in the shoulder. The free upper limb includes the humerus, radius, ulna, and bones of the hand. The clavicle is a S-shaped bone that connects the arm to the body, acting as a strut to stabilize the shoulder. The clavicle has 3 parts: the sternal end, the body, and the acromial end. The scapula is a flat triangular bone located on the posterior aspect of the ribcage. It provides attachment sites for muscles and forms the glenoid cavity, where the head of the humerus fits to create the shoulder joint. The humerus is the single bone of the upper arm, connecting the shoulder to the elbow. Here is a detailed diagram of the humerus showing the major anatomical landmarks of its upper end, shaft, and lower end. The radius is one of the 2 bones in the forearm, located on the lateral side. Its proximal end articulates with the humerus and ulna, while the distal end connects to the carpal bones of the wrist. The ulna is the larger medial bone of the forearm, located on the side of the little finger. Its proximal end features the olecranon, which forms the elbow joint by fitting into the olecranon fossa of the humerus. Let's now talk about the bones of the hands. There are as many as 27 of them in each hand. The bones of the hand include the 8 carpal bones shown in pink, 5 metacarpals shown in blue, and 14 phalanges shown in purple. The carpal bones are 8 small bones in the wrist, arranged in 2 rows. They are the scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate bones. The metacarpal bones are the 5 long bones in the palm of the hand, numbered from 1 to 5, starting from the thumb side. The phalanges are the bones of the fingers. Each hand has 14 phalanges, 3 for each finger, proximal, middle, and distal, except for the thumb, which has 2, proximal and distal. The bones of the lower limb include the femur, patella, tibia, fibula, tarsal bones, metatarsals, and phalanges, which collectively support body weight and enable movement. The femur is the longest and strongest bone in the body, located in the thigh, and connects the hip to the knee. It has a ball-shaped head that fits into the acetabulum of the pelvis, forming the hip joint, and its distal end articulates with the tibia and patella to form the knee joint. The tibia is the larger and stronger of the 2 bones in the lower leg, located medially, and bears most of the body's weight. It connects the knee joint with the ankle joint, articulating with the femur at the knee and the talus at the ankle. The fibula is the smaller lateral bone of the lower leg, running parallel to the tibia. While it does not bear significant weight, it provides support and stability to the leg and serves as an attachment point for muscles. The patella, or kneecap, is a triangular-shaped bone located in front of the knee joint. It protects the knee and enhances the leverage of the quadriceps muscle, aiding in knee extension. Let's now talk about the bones of the foot. There are as many as 26 of them in each foot. These bones are classified into 3 groups: the tarsals, 7 bones in the ankle and heel, shown in pink; the metatarsals, 5 bones in the midfoot, shown in purple; and the phalanges, 14 bones in the toes, shown in blue. The 7 tarsal bones in each foot include the talus, calcaneus, navicular, medial cuneiform, intermediate cuneiform, lateral cuneiform, and cuboid, which support body weight and enable foot movement. The metatarsals are 5 long bones in the foot, numbered 1 to 5, starting from the medial, or big toe, side. The phalanges are the bones of the toes, with each toe having 3 phalanges, proximal, middle, and distal, except for the big toe, which has 2. Thanks for watching. Don't forget to like, subscribe, and hit the bell icon for more anatomy insights. See you in the next video.